table. I think somebody was asking me, but Dr. Bruni, obesity is usually associated with
secondary.
Yes, with secondary. And this is a table from Up to Date. Obesity, possible etiology, essential hypertension. Okay. Truncal obesity goes with Cushing's syndrome or corticosteroid therapy. If you have a child with hypertension and has growth retardation, think about chronic kidney disease. If you have a child with hypertension with tachycardia, think about hyperthyroidism, think about neuroblastoma. So this is associations, building association. If you have a child with hypertension and has blood pressure differences in the extremities, if the upper extremity blood pressure is greater than the lower extremity blood pressure, then think about coarctation of the aorta. Because what do we learn at first? At first, what did we learn? The blood pressure in the arm and the blood pressure in the leg, which one should be higher?
The leg.
The leg. So if you have a patient whose blood pressure in the arm is higher than the blood pressure in the leg, then it is out of norm. And one condition you should think about is what? Coarctation. And we said coarctation of the aorta is associated with which other condition?
Turner syndrome.
Turner syndrome.
Oh, today I am happy. Ooh, okay. So if you have a patient who has moon phases with hypertension, they're thinking about Cushing's syndrome or steroid therapy. If you have a patient who has thyroid enlargement plus hypertension, then you're thinking about what? Hyperthyroidism. If you have a child who has web neck with hypertension, then what are you thinking about? Turner syndrome. If you have a patient, now, this is the other point. If you have a patient who has tonsillar hypertrophy plus hypertension,
obstructive sleep apnea.
Obesity.
Obstructive sleep apnea.
Obstructive sleep apnea. If you have a child who has hypertension and if you do fundoscopy, there are retinal changes, they're thinking about severe hypertension. And if there's papilledema as well, you're still thinking about severe hypertension and raised intracranial pressure, right? This table is very important. More. If you have a child who has hypertension and looks pale with flashing, they're thinking about catecholamine excess, neuroblastoma. If you have a child who has acne, hirsutism, striae, they're thinking about Cushing's syndrome or steroid therapy. If you have a child with cafe spots or neurofibromas plus hypertension, you're thinking about neurofibromatosis. You see, it's a board exam, right? So you must, these critical things, you should not miss them at all. If you have a child with Ashley spots or adenoma sebaceum, and I showed you a picture, plus hypertension, then you should think about tuberous sclerosis. If you see a child with rash with hypertension, you should think about lupus nephritis or henox-colon purpura. If you see a child with acanthosis nigricans with hypertension, then you should think about what?
Polycystic ovary.
Well, polycystic ovary, but what can that lead to? Diabetes as well, right? If you see a child with widely spaced nipple plus hypertension, what are you thinking about?
Turner syndrome.
And what is it associated with?
Coarctation of the aorta.
If you have a child with hypertension and a mema, then you're thinking about coarctation of the aorta. If you have a child with hypertension and an apical heave, like boom, it's literally trying to lift up your hand. They're thinking about left ventricular hypertrophy, right? Because the left side of the heart has beaten so much so that it has become hypertrophied, right? If you do an abdominal exam and you can hear an abdominal bruit, what are you thinking about? If you do your abdominal palpation and you palpate a mass, what differentials are you thinking about? Hydronephrosis, polycystic kidney disease, Wilms tumor, neuroblastoma.
WCC.
Right? If you see a child with, hypertension and maybe has some casts and all other things, you're thinking about orthopedic manipulation, asymmetry in the leg. Asymmetry, one limb is bigger than the other, plus hypertension. Then you're thinking about Bedwick-Widerman syndrome. And if you have a child with hypertension plus arthritis, then you're thinking about what? Henox-Colon
purpura,
and collagen vascular disease like systemic lupus erythematosus. Hypertension with muscle weakness, think about Liddle syndrome, hyperaldosteronism. Hypertension plus diminished pain response, then think about familial dysautonomia. These are all highfalutin stuff, right? Common things are common. But we learned hypertension plus ambiguous genitalia. What are we going to think about?
congenital
Congenital
adrenal
Adrenal
hyperplasia.
hyperplasia.
And hypertension plus advanced puberty. We're thinking about intracranial tumors. Doctors, if you're able to memorize this table, know it inside out. When it comes to physical exam features and secondary hypertension, nobody, not even wicked Dr. Bruni, should beat you, right?